Hey, this is Lisa with Transformations Therapeutics, and today we're going to talk about the IT band. It's one of my favorite subjects if you're a client of mine, so that you know, but I want to go into a little bit more detail about what is the IT band, what kind of problems can it cause, where do you most usually see it, and what can you do to keep it loose and flexible between massages. So let's talk about a little bit about what the IT band is. It is a strong, thick, fibrous band of tissue that goes from the hip down to below the knee. So any kind of tissue that crosses over a couple of joints is going to have a tendency to be tight, just like any of the other muscles in the thigh. So it's also connected to the glute muscle, and there's also a muscle right here that brings the leg away from the body. So it's intertwined in with the hip. Some of the problems that are most commonly seen are in runners that I see, but at times also moms-to-be can also get tight IT bands. Number one, their whole base has changed in how they stand and sit. And the other thing is that they're spending most of their time lying on their sides because that's what they need to do to take care of their baby. So where you might see IT band tightness is pain develops in the low back. It can also develop in the knee. So lots of times runners will come to me with pain in their the side of their knee. It will develop also as hip pain, but there also can be swelling, acute swelling on the side of the thigh. So what kinds of things that you can look for is, are your running shoes worn, for example? That can contribute towards an IT band tightness. Are your feet what are called overpronated, so that you're putting a whole lot more of pressure and your arch is rolling in instead of having flat surface on your entire foot. Runners that, I also see it a lot of times in runners that don't cross-train. It's really important to be able to develop other muscles such as the quads and the hamstrings and the insides of the legs. So everything needs to be exercised in order to have proper balance and good form. So if your IT band gets tight, it just depends on how acute it is, how much of a problem it is. If you're just noticing some tightness, you can go ahead and see your doctor or your chiropractor to assess the situation. But massage is a good treatment as well as physical therapy. In massage, what I do is I have people lie on their sides so that I can work out and lengthen the IT band and get people more upright. So lots of times people will ice. If there is swelling, you follow the rest ice compression and elevation of your leg. So Becky's going to show us how to do foam roller properly. The foam roller is something that you can use between massages, especially before or after running, so that you can keep that IT band nice and smooth and lengthened. Otherwise it'll feel just like knots in the sides of your legs. So I'm going to hand it over to Becky. So she's on her side. She's going to show us two ways to do this. So you place the foam roller at the base, just right above your knee, not on your knee joint. And roll down, but roll all the way up to the hip. Now, as you notice, she's taken her top leg and bringing it over so that you can kind of control how much pressure you put on the IT band as you're rolling it out. You can get foam rollers at a couple of places in town, but you can also order them online. You can see how slowly she's rolling out her IT band. Now, if you're really hardcore, you can just bring your leg up, and you're actually putting all your pressure into the foam roller. It'll get it done faster, but this is not for the faint of heart. Good. So the slower, the better, because once you hit a point that you're like, oh, that hurts, or that's a little more painful than another point. You want to hold it on that point, because within 30 to 90 seconds it's going to melt. You just feel it dissipating. Whatever pain was there will just dissipate. So what this does is it actually keeps it lengthened. It keeps the IT band movable and supple. A lot of times what happens is that since the IT band combines a little bit with the quads muscles on the front, what can happen is it's there to stabilize the knee, but if it gets too tight, it's going to torque the knee. So this is like a lot of what happens with distortion in hip posture as well. It could just get tight on one side of the leg and kind of torque your hip and back. Good.
Yay.
Yay. So this is Lisa with Transformations Therapeutics, along with Becky Fox of Fox Fitness. Transformations Therapeutics. Move easier, hurt less, live more. Thanks.